This is an article that came out on News Channel 11, WJHL.com, November 20th, 2017. Dangerous drug fentanyl on rise in Tennessee. And I will leave the link to this article in the description box. But let's go ahead and play this video.
Tonight, a drug that can kill someone with just a few grains is taking lives right here in our region.
It's so dangerous. The state of Tennessee issued a public health advisory this year, and law enforcement is being forced to rethink how they protect themselves. Sydney Cameron is in your corner uncovering the dangers of fentanyl.
My life's been full. I've savored much. Good friends, good times, a loved one's touch. You say that fits your son?
Yes.
Nearly 8 months after his son's death, it's still hard for Dr. Clay Renfro to talk about it.
That I can tell that from the stories that you tell.
His only son, Frederick, and Dr. Renfro shared a lot. A career in medicine and a love of fishing.
But I was with him when he caught that. And he fought it for a good while before he ever got him on land.
Renfro also had a long fight with opioid addiction. From an early age, he suffered severe pain from kidney stones and depression, which eventually led to addiction.
Knew there was some problem for several years, but getting him to accept that he had a problem was the big issue.
In March, at just 46 years old, Renfro died from an overdose of an extremely powerful synthetic opioid called fentanyl.
Is a significant threat.
Fentanyl is a narcotic painkiller typically used for cancer patients. It's similar to morphine, but is much more potent. Illicit versions made and sold on the streets are up to 10,000 times more powerful. From 2015 to 2016, both Tennessee and Virginia saw big increases in drug overdose deaths related to fentanyl.
It can be absorbed through the skin, transdermal, or it can be inhaled.
Using a combination of sugar and artificial sweetener, Tommy Farmer with the Tennessee Bureau of Investigation showed us just how dangerous fentanyl can be. So these specks on my finger right now, if this was fentanyl...
More than enough to overdose you.
Lethal.
Lethal.
Farmer says it only takes the equivalent of 3 grains of sugar to overdose on fentanyl. However, the consistency of fentanyl is much more fine, like a powder, making it easier to spread.
You can see the powder.
Okay, ladies and gentlemen, we know it's bad. We know it's bad. A dangerous drug is gaining popularity in Tennessee and Virginia, taking lives in the Tri-Cities region and putting law enforcement at risk. Earlier this year, the Tennessee Department of Health issued a health advisory on fentanyl. Fentanyl is a powerful drug used legally to treat extreme pain, but it has found its way to the illegal drug market and is killing people. Now, the fentanyl, again, if you've been following my videos, then you know that the fentanyl on the streets is coming in from China. That's where it's coming from. All right, I'm just going to go down because the paragraphs right, above this one are just going over what the doctor spoke about as far as his son ODing and dying. According to the Tennessee Department of Health, from 2015 to 2016, the volunteer state saw a 74% increase in drug overdose deaths related to fentanyl. In 2015, 169 Tennesseans died from fentanyl, while 294 people died in 2016. The Virginia Department of Health reported a 176% increase in fatal fentanyl overdoses during that same time period. Reports show 225 Virginians died in 2015 and 622 died in 2016. So it is really not going anywhere. It's only going to get worse. as long as the street drug is out there, fentanyl is literally being mixed in with everything, everything right now. Okay, marijuana to opioids to heroin, even the fake Percocets they're selling on the street, it's being mixed in with everything. And see, this wouldn't be happening if the drug addicts, the users, weren't looking for a stronger high. And, so the drug dealers are going to try to accommodate that. News Channel 11 reached out to law enforcement agencies across Tri-Cities and found out almost all of them now equip their officers with naloxone, a medication that reverses the effects of an overdose. Officers have it on hand in case of an accidental overdose. Some departments, including the Washington County, Tennessee Sheriff's Office, Kingsport Police, and Bristol, Tennessee Police, also have naloxone for their canines because of their sniffing puts them at higher risk for exposure. I just don't see how you can use dogs, period, at this point. Departments are also providing additional training to its officers on how to handle unknown substances and requiring them to wear gloves, masks, and sometimes bodysuits when encountering suspected fentanyl. TBI, crime labs now required suspected fentanyl cases submitted for testing to be double bagged in plastic. Departments also have to notify the crime lab if they think a case submission might be fentanyl at the time of submission. Dr. Renfro hopes his son's story will help save the next person. Well, at the way this drug plague is going, that's highly doubtful. It really is. And it's a shame, but this is where this country is. It has an addiction that just can't be controlled. Please tell me what you think. Please leave your comment and subscribe. And don't forget to hit that notification bell. Peace, family.